Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist in the Triangle area of North Carolina, and this is Obesity Medicine Perspective. If you've been watching these videos, you know that I've really covered a lot of ground and talked a lot about insulin being a fat storage hormone and tailoring your diet to bring that insulin level down so you get rid of that fat storage signal. And that's kind of been the gist of everything we've been talking about so far. And I want to kind of deviate a little bit from that and talk a little bit about my own experience. So I've been in practice in this area of the Triangle since 2007, and I have a lot of patients, and so they ask me a lot of questions about my own weight and about what I'm doing and this sort of thing, and I've got a lot of requests to talk about that, so I'm going to go ahead and start talking about that today, and maybe over a couple videos we'll cover this subject. So my patients have noted that since the beginning of the year that I've lost some weight, and indeed I have. I've lost about 55 pounds since the first week of January, and now at the time of the recording of this video we're already into August. So they are right. I have been losing weight, and I do practice what I preach in this regard in terms of losing that weight. They've also noted that my hair is growing out. Now, for those of you who don't know me, I normally have very short hair. I have a military background. I was raised in a conservative family where you always got a short haircut. And in April, at a scientific meeting of obesity that was in Denver, Colorado, I was involved in a fundraiser for what's called the Obesity Treatment Foundation. Now, the Obesity Treatment Foundation is a great organization that raises money, and they use this money to educate physicians about the disease of obesity and how to treat it. They also fund a lot of research, and if you've ever tried to get funds to do research, it can be a process that's very hard to do because there's a limited amount of money, and there's a grant writing and all of this other sort of thing that requires almost a machinery in place to get the money that you need to conduct a study about obesity. Well, through the Treatment Foundation, physicians who have very good treatment ideas, theories, hypotheses, can actually get money from the foundation in a much easier fashion and conduct studies to test their hypotheses. And this is really important because we need more treatments for obesity. So I support this organization, and I actually took a dare to grow my hair for a year without cutting it, and a large number of people are sponsoring the amount of hair growth that I have, and they're going to give that money to the foundation. So more or less I'm growing my hair for the purpose of a charity, and I'm going to end up inviting you as patients to be involved in that if you would like to be. It would just be a small amount of money, and it would be next April of 2016 that the money would be due, and it's based on the amount of hair that I can grow. Perhaps an easier way for a lot of my patients would just be to have you sponsor at $5 or $10 rather than to ever wait and measure the amount of hair that I can grow. Maybe that's too laborious of a process. Either way, I'll keep you informed about that and give you the opportunity to do that because it's a great organization. Now, as far as my weight loss, I have lost 55 pounds since the beginning of the year, and the diet that I use is a low-carbohydrate diet. Now, I've given you the whole background on insulin and how much blood sugar you have and how much carbohydrate you need and the fact that insulin's a fat storage hormone and all of that, and I put all of that to work. I do a low-carbohydrate diet that on most days is under 20 grams of total carbohydrate a day, and on many days it's actually under 10, and there are some days when I actually get to 0. And this has worked very, very effectively in my life, and I continue to follow that, and I've lost pretty much all of the weight that I want to lose, and now I'm kind of entering into a weight maintenance phase. So on the next video, I'm going to talk some more about my experience so that you know about that, and I would encourage you to follow along on that video. I encourage you to follow us on our social sites, our Facebook site, our Twitter site, and remember, if you follow there, you can get a free InBody 770 body composition analysis test, so go there to learn how, and until next time, I'll give you the tools, you give me the effort, and together we can beat obesity.